Stress is one of the most underestimated threats to heart health, and yet it is something almost every individual experiences daily, often without realizing how deeply it affects the cardiovascular system. When the body perceives stress, whether physical, emotional, financial, or psychological, it activates the stress response system, releasing hormones like adrenaline and cortisol that increase heart rate, raise blood pressure, constrict blood vessels, and prepare the body for what is commonly called fight or flight. And while this response is helpful in short bursts, the real danger begins when stress becomes chronic, lingering day after day, silently forcing the heart to work harder than it should, leading to persistent high blood pressure, inflammation within the blood vessels, disruption in cholesterol balance, increased blood sugar levels, irregular heart rhythms, and even structural strain on the heart muscle itself. Over time, this constant overload accelerates plaque build-up inside arteries, weakens vessel walls, and significantly increases the risk of heart attacks, strokes, and heart failure. And what makes stress particularly dangerous is that it often drives unhealthy coping behaviors such as overeating, smoking, alcohol overuse, physical inactivity, poor sleep, and medication non-compliance, all of which further multiply cardiovascular risk, creating a cycle that gradually damages the heart from multiple directions at once. The truth is that many patients focus only on cholesterol numbers, blood pressure readings, or surgical procedures, yet overlook the emotional and mental burden they carry daily, not realizing that emotional stress alone can trigger chest pain, raise blood pressure within minutes, and even precipitate serious cardiac events in vulnerable individuals, especially those already living with coronary artery disease or recovering from bypass or valve surgery. Stress also affects heart rhythm stability, and individuals under prolonged emotional strain may experience palpitations, skipped beats, or episodes of atrial fibrillation, as the nervous system remains in an overstimulated state, constantly signaling the heart to beat faster and harder. Beyond the direct physical effects, stress interferes with sleep quality, and poor sleep further increases blood pressure, worsens insulin resistance, raises inflammatory markers, and prevents the heart from entering its restorative nighttime recovery phase, meaning the body never truly resets, and healing becomes slower and less efficient. So the real question becomes not whether stress affects the heart, but how to effectively manage it in a practical, sustainable way that strengthens both emotional resilience and cardiovascular stability. The first and most powerful tool is awareness, recognizing personal stress triggers and understanding how the body reacts, whether through muscle tension, headaches, irritability, fatigue, shallow breathing, or changes in appetite, because once awareness develops, control becomes possible. Controlled breathing techniques are among the simplest yet most powerful interventions, as slow, deep diaphragmatic breathing directly stimulates the parasympathetic nervous system, lowering heart rate, reducing blood pressure, and calming vascular tension within minutes. And practicing structured breathing exercises for even 5 to 10 minutes twice daily can significantly reduce stress hormone levels over time. Physical activity is another essential component, and regular moderate exercise such as brisk walking, cycling, swimming, or supervised cardiac rehabilitation sessions not only strengthen the heart muscle but also improve mood, reduce cortisol levels, enhance sleep quality, and restore vascular flexibility, creating both emotional and physiological resilience. Equally important is building structured daily routines, as unpredictability increases stress perception, whereas organized schedules with designated times for meals, exercise, rest, and relaxation provide psychological stability that reduces mental overload. Nutrition plays a vital role as well, because high sugar, high salt, and highly processed foods amplify inflammation and blood pressure responses, while whole foods rich in antioxidants, omega-3 fatty acids, fiber, and lean protein support vascular repair and stabilize energy levels, preventing stress-induced metabolic spikes. Social connection cannot be underestimated. either as meaningful conversations, emotional support from family, participation in community or spiritual activities, and simply sharing concerns with trusted individuals significantly reduce stress burden and lower cardiovascular risk markers. Mindfulness practices, meditation, gratitude journaling, and even structured relaxation therapies have shown measurable improvements in heart rate variability, which is an indicator of healthy autonomic balance and a resilient heart. For those recovering from heart surgery, stress management becomes even more crucial, as fear of recurrence, anxiety about physical limitations, and uncertainty about the future can hinder recovery progress, delay physical rehabilitation, and negatively affect wound healing. Whereas patients who adopt calm, structured recovery plans with guided activity progression, emotional support, and realistic expectations tend to regain strength more confidently and steadily. It is also important to address workplace stress and boundary setting, as many individuals return to high-pressure environments too quickly after cardiac events, neglecting the need for gradual reintegration and learning to prioritize health, delegate responsibilities, and say no when necessary is not weakness but long-term heart protection. Sleep hygiene deserves focused attention, including maintaining consistent sleep times, limiting screen exposure before bed, avoiding late heavy meals, and creating a quiet, dark sleep environment, because restorative sleep allows the heart rate and blood pressure to dip naturally at night, reducing overall cardiovascular strain. Another often overlooked aspect is mental reframing, the ability to reinterpret challenges not as threats but as manageable problems, shifting the internal narrative from fear to control, which significantly reduces the physiological stress response. Regular health checkups provide reassurance and objective feedback, helping individuals distinguish between anxiety-driven symptoms and genuine medical concerns, thereby preventing unnecessary panic and improving confidence in recovery. Gratitude and purpose also influence heart health profoundly, as individuals who cultivate positive outlooks, engage in meaningful hobbies, volunteer, or pursue passions demonstrate better emotional balance and lower stress biomarkers. Ultimately, protecting the heart requires understanding that surgery, medications, and medical technology address structural issues, but daily habits, emotional resilience, and stress regulation determine long-term outcomes. And the goal is not to eliminate stress completely, which is impossible, but to develop adaptive responses that prevent chronic overload, allowing the heart to function efficiently without constant hormonal strain. When stress is managed proactively through breathing control, physical activity, balanced nutrition, strong relationships, structured routines, restorative sleep, and mindful emotional awareness, the heart regains stability, blood vessels relax, inflammation decreases, and overall cardiovascular risk declines significantly. Living more by stressing less is not just motivational language, it is a measurable physiological strategy that supports arterial health, stabilizes rhythm, improves recovery after cardiac procedures, and enhances longevity, proving that healing the heart requires both medical expertise and consistent lifestyle alignment. And when individuals commit to these principles daily, they build not only a stronger heart but also a calmer, more fulfilling life that sustains cardiovascular health for years to come.